The cancellation of thousands of flights at the end of last week is no longer the only indication that the world has become at the mercy of the Omicron mutant, whose extent of its spread and the speed of its application are known only to countries that have high capabilities for testing and monitoring infections that often do not carry apparent symptoms. Tens of millions are currently subject to home quarantine measures in the United States and Europe, according to recent estimates by the Institute for Public Health Measures of the University of Washington, which expects this number to triple or more in the coming weeks, while the number of people infected with Omicron is likely to reach 3 billion in the world. By the end of the first quarter of next year, which is equivalent to the total global injuries over the past 2 years. Others do not rule out that no one will survive this latest mutation of the virus, which the scientific community tends to say at the present time is low, but calls for patience and caution while waiting for more clues and evidence. Lock Ghost. European governments are racing against time with successive packages of preventive measures to contain the outbreak of the epidemic, and their eyes are on the economic repercussions that are feared to destroy the growth that has been achieved in recent months with the progress in vaccination campaigns. But the specter of the actual general closure again hangs over most of the countries that started signs exhaustion appears on their health systems. And the European Centre for Communicable Diseases Control and Prevention warned in a statement yesterday, Monday, that what the air transport sector witnessed, with the cancellation of thousands of flights due to injuries among crews, may be repeated in the health sector with an increase in the number of injured among health personnel. After fears focused in recent weeks on Germany and Austria, which witnessed a huge explosion in the number of new infections that exceeded all previous figures, attention is now turning to Spain, where the entry into force of the new mutation has gone out of control in most regions, and to Italy, the brilliant student who was the chancellor. Former German Angela Merkel has been singing a few weeks ago about her good management of the pandemic and hopes that her country will follow suit. Today, she is also a captive of Omicron, whose injuries double every 2 days and push increasing numbers to hospitals and intensive care units. Recent data from Germany and Austria indicate a marked decrease in the number of new daily infections, which fell to 10,000 in Germany, after it had exceeded 50,000 over the past weeks, while it decreased in Austria to 1,700 after it was more than 15,000 since the beginning of last month. The decline in the number of new infections in these two countries is due to the measures imposed by the two governments on the unvaccinated, and led to their effective isolation, as they are only allowed to leave the house to pharmacies and buy foodstuffs. But experts caution that these numbers must be approached with caution, because many local administrations do not report injury data during the Christmas holidays, and they advise waiting a few days before drawing the final conclusions. Non-relaxation measures. And the German Minister of Health, and the epidemiological expert, Karl Lauterbach, in turn called for not to relax in preventive measures, because the country is not immune to a new epidemic wave with the Omicron mutated, whose infections are still less than 20% of the total new infections, while expectations indicate that the speed of its effect will make it the dominant variant before the first half of next month. For its part, the Robert Koch Institute stated that the data available so far on the new mutation indicate that the symptoms it causes are not dangerous, but it is advised to wait to learn more about it, and stresses not to reduce prevention and containment measures. And the German Ministry of Health announced yesterday that 30% of the population will receive the booster dose of the vaccine by the end of this year. Austria, for its part, is still far from achieving the goal of giving the booster dose to a third of the population by the end of this year, but it will start a unique experiment so far in Western countries, which is to impose mandatory vaccines starting from the beginning of next February, when those who are scheduled to be fined will be fined. They refuse to receive the $5,000 vaccine and are prevented from using public transportation and going to public places. Vaccine rejectionists. While the attention of the Italians is directed to the German and Austrian experiences of dealing with groups who refuse to take the vaccine for several reasons, the Italian government faces the dilemma of dealing with the large and very rapid increase in the number of new infections and isolating the infected and those who contacted them, which may soon lead to an actual general closure of the country. The Ministry of Health estimates that the number of those who are currently subject to quarantine due to infection or contact with infected people exceeds 2 million, while the percentage of cases treated in intensive care units reached 20% of beds in some regions. After the British experience that led to 1.7 million workers being quarantined simultaneously, some productive activities were suspended and the government was forced to reconsider the definition of the concept of communication, and after the partial paralysis that afflicted the civil aviation sector during the past days, the Italian government fears that the developments of the epidemiological scene will lead to disrupting the economic cycle, and began to think about following the example of South Africa, which recently decided to cancel the ban on contacting people with the new mutation, which is expected to prevail in Europe by the middle of next month. The cancellation of thousands